Hi everyone, welcome to our channel. Today we will be discussing about coagulation and bleeding disorders. First we will discuss about coagulation. So what is coagulation? Coagulation is the hemostatic process. It is used to prevent or arrest bleeding and results in formation of clot. So what is coagulation? Coagulation is the hemostatic process which is used for the prevention or arrest of bleeding and which results in the formation of clot. So, mechanism. So, how coagulation occurs? First the vessel will produce prothrombin activate. It is released from the injured vessels. So this prothrombin is further converted into thrombin. So this thrombin acts as an enzyme in the conversion of fibrinogen into fibrin. So the mechanism, first the injured vessel will be releasing the prothrombin activator. So it activates the prothrombin to formation of the thrombin. Then thrombin acts as an enzyme to convert fibrinogen into fibrin. Then fibrin combines to form the clot. This is the mechanism of coagulation. Then we will be discussing about the factors. There are 13 factors of coagulation. We will discuss one by one. So totally there are 13 coagulating factors. The first one is, there is a mnemonic which we can remember it easily. That is, freshers party tonight, come, let's sing and call senior, please have fun. This is the easy way to remember the clotting factors. First one is for F. It is fibrinogen. And the second one, it is prothrombin. And third one, it is thromboplastin. Then fourth one, it is calcium. Then fifth one, it is Label factor. Then sixth, it is not found still. Then the seventh one, it is stable factor. Then eighth one, it is called as the hemophilic factor. Then the ninth one, it is called as the Christmas factor. Then 10th one, it is Stewart factor. Then 11th one, plasma prothrombin antisense. Then the 11th one, H for Hageman's factor. One, it is Fitzgerald factor, that is high molecular weight kinogen. So these are the 13 factors which is responsible for the coagulation. Then the coagulation usually occurs in two pathways. First one is intrinsic pathway and second one is the extrinsic pathway. Intrinsic pathway is defined as the process which takes place in the blood itself. Then the extrinsic pathway, it occurs from the injured vessels. It is the extrinsic pathway. So now we will discuss about the intrinsic and extrinsic pathway. Intrinsic pathway. And extrinsic pathway. In this, plus collagen exposure. In this, in the presence of an HMW, that is high molecular weight kinogen, factor 12 is converted into factor 12A. Then in the presence of high molecular weight kinogen, 12A is converted into 11A. Then in the presence of calcium, the factor 11 is further converted into 9. Then in the presence of calcium and factor 5, it is converted into, then it activates prothrombin 5 and thrombin. Then we'll discuss about the, in case of collagen exposure, platelets are activated, then it directly produces prothrombin. Then in case of tissue injury, first glycoproteins and phospholipids are activated, then factor, in the presence of factor 7, it is converted into 10A. Then the presence of calcium, factor 5 and thrombin, it activates the prothrombin. So it further forms thrombin, it also further forms thrombin. This is called as the positive feedback. Then the activated prothrombin, we'll discuss it here. It forms thrombin. So thrombin act as an enzyme in the conversion of fibrinogen into loose thread. It undergoes polymerization process. and it further forms loose thread of fibrin. Then in the presence of factor 13, it forms the tight clot. This is the intrinsic and extrinsic pathway of coagulation. So how we'll find the, next we will discuss about the test of coagulation. Test of coagulation. What are the tests available for coagulation? There are, first one, bleeding test. It is the time taken from the blood oozes from the vessel to stoppage of bleeding. So, time taken from the blood oozes from the vessel to the stoppage of bleeding. It is called as the bleeding time. It is usually 6 to 3 to 8 minutes. Then clotting time. It is the time taken from bleeding start to the formation of clot. So what is clotting time? It is the time between the bleeding and the formation of the clot. It is usually 3 to 6 minutes. Then third one, thrombin test. It is time taken for the blood to coagulate after adding thrombin to it. It is usually 12 to 20 seconds. Then fourth one, prothrombin test. It is the time taken for the blood to coagulate after adding prothrombin to it. It is usually 10 to 12 seconds. Then activated partial prothrombin test. It is the time taken for the blood to coagulate after adding partial prothrombin, activated partial prothrombin to it. It is usually 30 to 40 seconds. Then now we will discuss about the anticoagulants. First one, heparin. It is naturally produced by our body by mast cells, liver and lungs. It is given 0.5 to 1 milligram per kg of the weight. Then second one, decaumerol derivatives. First one, there are two. First one, this is coumerol derivatives. Then the drugs are decaumerol and warfarin. It is 2.5 to 5 milligram orally. Then EDTA. It is the strongest anticoagulant we ever know. This is the strongest. It is used in the lead poisoning. It is available in two salts, disodium and tripotassium. That is ethylene diamine tetraacetic acid. Then tripotassium ethylene diamine tetraacetic acid. Then oxalates and citrates. It's combined with the calcium to form calcium citrate. Hence it blocks the and next we will discuss about fibrinolysis. So fibrinolysis means lysis or breakdown of blood clot. Then we will discuss about the mechanism. After the endothelial injury, the clot is formed. So for the breakdown of the clot, thrombomodulin combines with the thrombin. Then it forms 3 in this. Lysosomes are also activated. Thrombomodulin and combines to form thrombomodulin, thrombin complex. Then it activates protein C. Then this, in the presence of protein S, it will inhibit the factor 8 and 5. Then it will inhibit plasma inhibitor, plasma thromboplastin inhibitor. So when it is inhibited, it further combines to form. So UPA is activated. Then plasminogen is converted into plasmin. This is the mechanism of fibrinolysis. Then next we will be discussing about thrombosis. So what is thrombosis? When it occurs? After a blood clot, if a fibrinolysis occurs, it is a normal process. If fibrinolysis does not occur, a thrombus is formed inside the vessel. If the thrombus breaks and it enters into the circulation, it is called as emboli or embolus. So why thrombosis occurs? Causes. First one, it may be due to agglutination of red blood cells, or it may be due to sluggishness of blood, or it may be due to rough endothelial layer. So what will be the complication? If thrombosis occurs, it may lead to the formation of embolism. Then if embolism go and blocks the vessel, it may cause ischemia, and it also causes necrosis. These are the complications of thrombosis. So our next and last topic is bleeding disorders. In bleeding disorders, we will be discussing about hemophilia, von Willebrand disease, and third one, purpura. So first we will discuss about the hemophilia. It is an X chromosome disorder. It occurs due to the absence of factors 8, 9 and 11. So there are three types of hemophilia. Hemophilia A, hemophilia B and hemophilia C. Hemophilia A is the major type of hemophilia, and it is occurs due to the absence of factor 8. And hemophilia B, it occurs due to the absence of factor 9. Hence it is also called as Christmas disease. Then third one is the least common type of hemophilia. It occurs due to the absence of factor 11. Then it usually occur in males. Then we will discuss about the inheritance. First one, if father is affected, then son will be normal and daughters will be carriers. If mother is affected, then sons will be maybe normal or will be affected. Daughters may be normal or they will be the carriers. Then the ratio of A and B. It is 7:1. Then we will discuss about the von Willebrand disease. It is due to the absence of von Willebrand factor. So how it affects the bleeding process, coagulation process. This factor, the von Willebrand factor, is responsible for the survival of factor 8 in plasma. Hence, if the absence of von Willebrand factor occur, it will be lead to the absence of factor 8 and 7. Hence, leads to the bleeding. In purpura, there are three types. Thrombocytopenic purpura. So, Thrombocytopenia, what it means? It means the less amount of platelets. It occurs due to some known cause like dengue. Then second one, idiopathic thrombocytopenic purpura. In this also platelet count decrease due to an antigen presence against the platelets, but the cause is unknown, hence it is called as idiopathic purpura. Then third one, it is thrombocytopenic purpura. In this type, platelets count are normal, but platelet present they are structurally different, hence it affects the bleeding. In all these bleeding disorders, bleeding time will be increased, but clotting time will be same or normal. So that's all about the bleeding disorders. Then thank you for watching the video. Thank you so much.